We start by creating an environment conducive to achieving the best results. So let's set the scene. The therapy pool must be private, indoors, well ventilated, and heated to a temperature of 34 degrees centigrade. It's called thermoneutral. It's warm enough to ensure the body's core temperature stays within the normal range, especially for patients who can't generate body heat through exercise, and it's cool enough to dissipate any heat generated from exercise. The body can stay in this temperature for extended periods of time and won't get too hot or too cold. Remember that water transfers its temperature into the body's tissues 25 times faster than air. If our body can't move well, we can't use exercise to warm up the tissues. But in a thermoneutral pool, we don't need a warm-up. Tissues are heated almost instantly and primed for exercise and mobilization. Saves a lot of time. Economy. For pain conditions, the uniform warmth has a sedative effect on nociceptors and triggers an immediate relaxation response from the sympathetic nervous system, giving the body a window where pain sensitivity is less. This deepens breathing, decreases guarding, and reduces muscle spasticity. The warmth works with buoyancy to achieve better range of motion. It also makes patients more receptive to massage, stretching, and body work when they're floating in a neutral position, and this helps release stiffness and improves mobility. It also works wonders for their mood and state of mind. Water quality is critical to keeping patients safe. 34 degrees can become a breeding ground for many unwanted strains of bacteria. In my experience, chlorine or bromine are the best sterilizing agents at this temperature, and their levels must be monitored daily. Outside the pool, the bathrooms and changing areas need to be accessible and heated. We've also put in a heated towel rail because even in summer, coming out of the water, it gets chilly and we begin to lose some of the benefits of the session. The therapy session must be private and one-to-one, and the therapist must always be in the water with you. So even if you can't swim, you feel safe and you are able to work correctly. The affected area must be completely immersed. This is important for a couple of reasons. First, to offload the joints and provide respite from gravity. Buoyancy is a powerful factor in alleviating the weight and impact that we feel when exercising on land. This gives us a window of freedom to correct movement and retrain muscle groups. Without gravity, we can work safely and at the right intensity. Secondly, heat transfer to all surrounding tissues. In a recent study published last year, Maria Gerondoudis at the University of Porto in Portugal studied the impact of different factors of aquatic therapy as an intervention for painful shoulder disability. She found significant differences in kinematic parameters associated with different buoyancy conditions, and that deep water promoted better alignment and bilateral symmetry on movement. We must take advantage of the freedom, warmth, and weightlessness that the water provides so that we can achieve results. Once the area is completely immersed, we aim for perfect alignment. As perfect as possible, because sometimes restrictions don't allow for this at the outset. But because guarding is less, and the tissues are more relaxed in the uniform warmth, the therapist can usually achieve this by manually stabilizing the affected area. In most chronic pain conditions, muscle patterning has changed so that correct alignment may feel completely wrong. Correct alignment is critical in activating the right muscles, stretching in the right way, and retraining these patterns so that they are corrected on land. So it's very important to brace the alignment during movement and guide the movement until it can be performed correctly. Bilateral movement is also very important to achieving the balance that we want between left and right sides. They work holistically to restore strength and natural alignment. Exercises that involve alternating arm movements also help achieve symmetry of affected and unaffected sides. The water not only eliminates many of the restrictions that the patient experiences during land-based exercise, the therapist can also work with greater ease and efficiency. Correcting the form and guiding the movement is much easier because of the freedom and access we have to the affected area. It's quite effortless. No matter how tall or short the patient is, I can bring them to the level that I want them so that I can work in front of my chest, my power center. I'm using my own chi and physical strength in a safe and efficient way. Economy and balance. And then the movement becomes the medicine because it's correct. Here we use turbulence, the drag force that presents when you move through water. This is a useful tool because water currents test the mobility and stability of the patient. No joint can move in isolation. This reveals important information to the therapist. As soon as the patient begins to move, the body starts to tell its story. It quickly reveals the root of the problem. Then we find the I can zone. This is the zone that's pain-free. You see, the water allows for movements that are usually larger and less painful than in air. So the neural pathways are laid for I can. And this is so important, both physically and psychologically. Once we find the I can zone, we work hard, and we do this by manipulating speed. The water's viscosity and hydrostatic pressure together achieve three-dimensional stability and resistance on movement. It pushes back at you just as hard as you push forward. This means movements are slower and more fluid, and you are challenged in more numerous and functional planes. Slow movements are wonderful for stabilizing joints and gently retraining muscle patterns. This creates a workout for the injured tissue that is both safe and that the patient is in complete control of, simply by controlling the speed. It meets them exactly where they need to be met on the day. If they double the speed, they quadruple the resistance, and this figure compounds exponentially. Sometimes movement is assisted because the patterns are such that the tissues need a reminder on how to work correctly. But for the most part, movement is resisted. Remember that the resistance is always in the opposite direction of movement. It means that when performing a circular movement, the resistance is also circular. For complex joints like the shoulder, this is hugely important and beneficial, especially for proprioception. We respect the limits of strength and range, but challenge just enough so that post-treatment inflammation is kept low, and the next time we work, we are stronger and we can achieve more. On this point, we need to be careful of the sedative effect of warm water on the nociceptors, especially with arthritic patients. They've been limited on land and get very happy in the water, so they go overboard and they can't move the next day. So we rein them in and ensure that they're working safely. On the other side of the spectrum, for athletes, the fact that water meets you where you need to be met in terms of strength, range, and endurance means that you can really fine-tune the relevant exercises which will enable them to return to full performance without sustaining further injury. This is powerful. If we need more space to work underwater, we create it. And if necessary, we can use equipment such as fins to increase resistance so that the patient is challenged on the day. I love the way we can work with agonist and antagonist in the same exercise. The water resists both one way and the other. So beneficial and effective to balance strength and regain normal patterning. This is difficult to do on land, and it saves so much time. Something unique to this form of hydrotherapy is dynamic palpation. I have beautiful access to release muscles while they are at work. Because of the perfect alternating balance between working and resting tissue, it responds so quickly to palpation and becomes more elastic as the exercise progresses. Economy and balance. Then we stretch. I'm pedantic about correct alignment, so the therapist usually braces the area to ensure correct alignment throughout. Stretches are passive, where the patient is always in complete control of their stretch. This is important because guarding is less and relaxation is deeper. Here we prompt deep breathing, specifically a deep exhale for a deeper stretch. The buoyancy allows for easy correction, the warmth and relaxation response for greater elasticity. Stretching is a very important part of shiatsu. When animals stretch, they fully inhabit their body, prime their tissues for optimal performance, and stimulate the flow of qi. After the active work comes intensive rest. We float the patient with special floats under the head and under the legs, and ensure that no muscle groups at all are engaged, and the body is neutralized in the correct alignment. We designed a head pillow that provides this perfect natural alignment. It can be adjusted and can be used for all ages, head sizes, and neck lengths. Just as we ensured the correct form of an exercise in the active work, I'd like to stress that the correct alignment of the body in float is critical to achieve the results that we want. The more the patient relaxes, the greater access the therapist has to the body's tissues, the better the results. While floating, the patient also hears the most beautiful sound in the world, his own heartbeat. The warm water and the thump of your heartbeat helps you to return to yourself, to let go and disengage every single muscle in your body. In this deep state of relaxation, the mind is calmer, we let go of our preoccupations, and are reminded that the whole is greater than the sum of the parts. We are much more than our diagnosis or injury, however overwhelming and encompassing our condition has become. Some patients describe this as a womb-like experience. Others say it's the best thing since outer space. It's about letting go. When we let go, we float. We are carried. We submit to gentleness. This is the key to unlocking the power of the water, the power of our own healing. We just float. Nothing else is required of us. We inhabit the present. We become like water. The therapist is now able to access the body three-dimensionally and can work with relatively little effort to apply specialized bodywork techniques which massage and mobilize in ways almost impossible on land. Sejak is a Korean hand and foot reflexology technique that is based on the principle that the whole body and its qi is mapped out and most accessible in the extremities. We use this technique to prime the affected area before actually working on it, because it is far more receptive to bodywork for having been primed. The hand is also the most public part of a person's anatomy. Patients are quite comfortable with having a hand or a foot touched first. Once primed, they relax into the floating and massage, and we can move on to other bodywork techniques. Here, I'm able to access the whole body, but specifically the affected area, three-dimensionally with relatively little effort, and apply massage, mobilization, gentle traction, and stretching. The whole purpose is to release tight tissue and restore the balance that we're looking for in the shortest possible time. I can work from any angle that I need to without straining my own body. Again, notice how I'm working within the scope of my power center, just like in martial arts or Tai Chi. In shiatsu, we use what is called a mother hand. This is the calming, still, supportive hand that counterbalances the hand that is working and provides a platform for the other hand to work effectively. There is also very little joint strain on the therapist. Water is about transparency, and so much is revealed about the body when it's floating suspended in water. I love the transparency. I can then get to work to address the issue, observing the limits of range and pain and pressure, so that we achieve the relaxation and release that will bring about the balance that we're looking for. Once we have applied the various bodywork techniques, we stretch. In shiatsu, stretching releases blockages in our meridians, much like stretching a long balloon filled with water, so that the flow of qi is stimulated. Breathing deeply in and out during stretches is very important. On a deep out breath, muscle holding and contraction is much less, and the stretch is more effective. The affected area is worked and stretched last. This is because throughout the session, we build up to this and culminate in very gently testing range and elasticity. Because floating in warm water affects our consciousness and sense of boundary, our body feels more and more boundless. As a result, we can achieve deeper stretches. In cases where the patient has been referred and can't swim or has a water phobia, we ensure that they receive the support that they need to feel safe. This usually means that they hold onto a bar during exercise and body work, but this doesn't necessarily affect the quality of the session. Going with the flow is part of this type of work. There is a distinct structure in the protocols that we apply, but within it, there is lots of room for creativity and improvisation.